Hello and welcome. Thank you for joining us for this recording of our web-based workshop series developed by the Direct Care Workforce Strategy Center and made possible through support from the Administration for Community Living. This Direct Care Workforce Strategy Center web-based workshop series brings together state teams, national partners, and subject matter experts to share practical strategies, tools, and approaches for strengthening the direct care workforce. Each session distills lessons learned, evidence-based strategies, and emerging practices from the field to support states and stakeholders in advancing systems change efforts. Before we begin, here are a few quick notes about today's recording. All viewers will see an ASL interpreter on screen. To access captions, press the closed captions or CC button on the video. Where possible, if a particular resource or data set is mentioned, a link is included below. If you experience any technical issues when accessing this video, please reach out to directcareworkforce@ncoa.org. Thank you again for joining us. Let's get started.
Looks like folks are starting to trickle in here. As a reminder, we did drop a little icebreaker in the chat so that we can get to know each other a little bit. And we'll get started in just about a minute here. Oh, Sandra shared a gift. Extra credit for you. Well, we are at the top of the hour. I assume folks will continue to trickle in here, but we have a lot to cover today, so we'll go ahead and get started. I'm so excited to join you all today for the first in a three-part workshop series focused on direct care workforce data. Today's workshop is going to focus on the foundational steps of prioritizing what workforce questions you have and starting to explore data sources to answer those questions. For those of you who aren't familiar, I'm Stephen McCall. I'm the Director of Research at PHI, where generally I help build the evidence base for direct care job quality. And PHI as an organization is a nonprofit dedicated to transforming elder care and disability services by focusing on the people who actually provide the care. We really believe that quality jobs lead to quality care, so we work with providers and policymakers to ensure the nation's 5 million direct care workers have the training, fair wages, and support they need to be successful in the field. We're really thrilled and thankful to serve as subject matter experts with the Direct Care Workforce Strategy Center and to connect with you all today about this really important topic. And we understand everyone's in different places, and that's okay. It's important that we use this space to connect with each other and learn from each other. As a reminder, we're going to be together until 4:30 p.m. Eastern Time, so about 90 minutes from now. Our time will be a mix of didactic learning, small group breakouts, and large group reflections. After today's workshop, we'll share a tool with you to help you guide you and your partners through the process that we're focusing on today. And we'll also share a recording and the slides from today for your reference in case, so when you're taking notes, you can focus on the big ideas. Please stay muted during the presentation to minimize distractions. We'll have dedicated off-mute time for group and Q&A and discussion. And also, please think of the chat as a collective notebook. Share your questions, your insights, your aha moments with the group at any time. We'd love to see your faces, so please stay on video, especially during small and large group discussions. However, also prioritize your own needs. So if you need to turn your camera off to regulate or rest, please do so without hesitation. And finally, you're welcome to step away whenever you need to. We don't have any breaks in today's session, but you're welcome to sit, stand, stretch, or fidget, or do whatever you need to do to remain physically comfortable and mentally present. So, with that housekeeping out of the way, let's talk about our agenda for today. We'll start with an introduction and overview, both with a short introduction to the center itself, and then I'll dive into today's subject matter. We're very lucky to be joined today by a group of leaders and experts from New Mexico who can shed light on their own experience getting started with direct care workforce data systems. Then we'll have some time for Q&A, both for myself and the folks from New Mexico. And finally, we'll spend about half of the day in small group discussions where you'll get to connect with each other and then report out to the larger group for a larger group discussion. So that's our plan for today. Before we dive into the content of and topic for today's workshop, I'd like to turn the floor over to Nicole Howell, the director of the Direct Care Workforce Strategy Center.
Thank you, Stephen. Appreciate your introduction. The Direct Care Workforce Strategy Center was created to strengthen state systems and support the recruitment, development, and the retention of the direct care workforce. Can I have the next slide, please? The center is funded by ACL and housed at the National Council on Aging, where in addition to providing technical assistance states, we develop tools and resources to support states and stakeholders, facilitate peer learning and sharing, and elevating promising practices that are ripe for adoption from the broader system. Now, our work is grounded in strong partnership with organizations like PHI, the University of Minnesota Institute on Community Integration, and the Center for Healthcare Strategies, whose expertise and collaboration help shape and guide our efforts. Now, this workshop series marks the launch of a new component within our broader technical assistance portfolio. It represents our first multi-session workshop offering designed specifically to support state systems efforts aimed at improving the direct care workforce in home and community-based settings. We're excited to add this format to our existing TA support and to create a space for deeper learning, peer exchange, and practical applications on the issues that are most important to all of you, like data, which is what I'm sure it brings you all here today. We want to acknowledge and thank our partners at PHI, Stephen, Jessica, Kezia, and all the folks behind the scenes that made this possible, as well as Julie from UMN ICI for co-leading this effort. And of course, our senior advisor, Serena Lowe, for bringing this all together. Their experience and commitment are central to the quality of this experience. And to all of you participating today, thank you for your engagement. Whether you were joining us live or watching later on in recording, your candor and your willingness to learn alongside us is invaluable. As this is our first workshop series, we know we are continually learning and improving. We genuinely appreciate your grace as we strengthen the work of the Strategy Center. Your feedback is incredibly important, so we encourage you to complete the evaluation survey that will be available at the end of today's session and to help shape and refine future offerings. We truly do these kinds of work because we have heard from all of you that it's valuable, and we really could not do that without your candor and your feedback. So I want to thank all of you for making the time to be here today and for all of your work to strengthen the direct care workforce. And with that, I turn it back over to Stephen.
Thank you so much, Nicole. And I just wanted to give you a little bit of a sneak peek. I'm sure that many of you are already registered for all three of these workshops. Like I said, today we're going to be focusing on the foundational steps of prioritizing workforce questions and data sources. But I really encourage you to join Julie Brashowski from UMN ICI in February, where she'll be presenting the sort of next steps in data collection, and my colleague Kezia Scales for part 3 later in February, where it'll really sort of put the pieces together and focus on developing an evaluative mindset to inform your data collection efforts. So ditto to Nicole's comments. Thank you to all of the folks. There are so many people involved in making this workshop series happen, and much. So let's turn to the elements of a strong and strategic workforce component. Strategic More specifically, at the end of today, you'll have learned your strategy developing data practices by identifying and engaging partners who have expertise about what data you need and how to get it, and also by defining the workforce based on job titles, service settings, programs, and employment relationships. And then with that foundational understanding of who we're talking about, specifying your data needs. So you know where to focus first and you're clear on what you really need. And once you have that established, then it's time to start exploring data sources to meet your needs. So you can start thinking about things like accessibility, reliability, timing, gaps, infrastructure. That's really going to be the focus of the next workshop in this series. So let's start with that first step of identifying and engaging partners. Engaging partners early and strategically will help you build the essential buy-in from them, converting them from experts or from sort of sideline observers and informers into data champions. We can think about this as a three-step approach. First, by prioritizing folks who have complementary knowledge and expertise that cover different parts of the landscape, whose knowledge fills gaps that others don't cover, and who understand how data are collected and should be used. And once you have these folks in mind, anticipate where there might be sensitivities or concerns that they're holding about direct care workforce data, things like capacity and burden to share and collect data. And with these sensitivities in mind, give some thought to shaping a value proposition to these potential partners to address those concerns and highlight the mutual benefits of strong workforce data. We can think about partners in two different groups. The first are your strategic partners who help set the direction, priorities, and policy relevance of your data collection efforts. These could be folks like state program leadership from across agencies who can help clarify policy priorities, but also constraints, and just to, from the get-go, foster that cross-agency collaboration that's so needed for direct care workforce data. You could also engage labor market experts, probably from your Department of Labor, who can weigh in at a high level about what data are available and methods for collection. And then to guide your efforts, engaging with advocacy organizations or membership associations who can help provide insight into priorities and data needs. And then finally, MCOs, if your state has them, who can serve as that bridge between state agencies and providers. Really important to get those folks involved from the start. And of course, this is a non-exhaustive list. I'm sure that you have folks in mind based on your own state's context. Later in the process, you might also want to engage with implementation partners who can help enable data access, collection, and integration. This is for when you move from the big picture to the nuts and bolts of actually collecting and using data. These are folks like state program staff or vendors like FMS or EVV providers, and potentially even direct care workers and providers themselves, depending on which data sources you plan to use to address your data needs. So now that you've assembled your all-star team of data champions, it's time to get clear about who it is you're talking about when you talk about direct care workers. This is an important step because so many of us are sort of touching different parts of the elephant, to use the sort of metaphor. It's important that all partners are aware of the full breadth and services that direct care workers provide and the diversity of roles that compose this workforce. It's also strategic because having a detailed sense of the roles that compose this workforce will be essential for getting specific about your data needs and data sources. We can look for definitions in a variety of places. At the highest level through labor standards, like from the Bureau of Labor Statistics or your state level Department of Labor. These are the kind of standardized occupational definitions that are true across states, but aren't particularly granular. To get more specific, you could look at state licensing and quality regulations to see how workers are defined there. And then, even more specifically, programmatic rules and regulations, things like state Medicaid service definitions, managed care manuals, or even EVV rules, which determine which workers are subject to those requirements, just to name a few examples. When it comes to actually cataloging the workforce, I'd suggest you follow a standardized approach, starting by just naming the role itself as it's described in whichever document is in front of you. And then also, for the purposes of shared understanding, noting the different titles for that particular role that are used in the field, because the two might not necessarily be the same. Also, describe who's employing these workers, which settings and providers, and are consumers themselves employing workers directly. And then finally, which related programs, payers, and services are related to this particular role. Now, of course, this can get complicated because of cross-referencing and different terms used in different places. So it is a challenging process in some cases, depending on your state. But like I said, well worth the effort. Just to give one specific example, this is from the state of Wisconsin. I pulled some citations to describe a personal care worker. In the field, they might be referred to as assistants or attendants or other job titles. We know that their employers, per regulations, are personal care providers, which include the entities listed there and under the regulations. These two have their own cross references to define these entities. And then finally, for programs and payers, these workers are primarily providing personal care under the state's managed long-term services and supports program called Family Care, and specifically the Personal Care Service. Now, you can see too here that I've tried to link to regulations that describe what I'm talking about, again, to build that institutional knowledge and shared understanding among your group of champions. Now that you're clear about who it is you're talking about, it's time to start thinking about what specific data needs you want to prioritize and work on. Maintaining a strong focus on which data needs you'll address first will help you maximize the impact of your efforts, and getting clear about exactly what you hope to measure will be essential as you explore data sources in the next step. Now, how to go about prioritizing data needs? There are a number of ways you can think about this, and I've listed a few here. Starting with policy and planning. Are there programs, initiatives, or policies that most urgently need better workforce data to support things like evaluation, oversight, or strategic planning? Or are there timely policy decisions or programmatic decisions that would be aided by better workforce data? You could also think about this in terms of stakeholder demand. What questions are groups external to your state agencies or to state agencies frequently raising? Are there workforce challenges that are widely reported and acknowledged, but not well evidenced or measurable using existing data? And then finally, readiness and momentum. What data already exist? Is there existing attention, leadership, interest, or political momentum around a particular area of data? And has there already been some preliminary work done that you could build on? So there are a number of ways that you could identify and prioritize your needs. These are just a few. Of course, this is a deliberative process with the partners in this work. Um, and once you've sort of identified what that need is, it's important to really get as specific as you can by specifying which workforce you're focusing on using the definitions that you've established in the previous step, which time frame and for which periods are you interested in measuring and looking at data? And then finally, which specific measures answer or address the need that you've identified? Here's an example of a general data need. How did wage increases funded by ARPA affect home care workforce stability? Now, of course, this is a pressing policy concern, but not necessarily operationalize. It's difficult to operationalize a workforce need in these terms. So it's important then to take a couple steps forward and get specific. You might ask, how did wage increases funded by ARPA affect quarterly turnover and retention of home care aides providing waiver services from 2019 to 2025 to try and get a kind of before and after picture? You could then go further and get specific about how you define turnover and retention, as I've done here using standard definitions in the field. And this, I think I'll sound a bit like a broken record here, is an iterative process, because as you're getting specific about your data needs and then exploring data sources, you might find you may need to adjust your expectations or approach when it comes to defining measures and time periods and things of that nature. And that's okay. That's to be expected. So let's talk about exploring data sources. There are infinite data sources you could draw from to address your data needs. We can think about them in three buckets, though. Starting at the highest level, you might use labor market data, like broad statistics on employment, wages, and workforce trends, or programmatic data that are getting a bit more specific, a bit more tailored to a more specific workforce need. And then even workers and providers themselves could be sources of data. So now I'm going to just go through in brief some of the advantages and disadvantages to these different types of data. Starting with that high-level labor market data, an example of this could be occupational employment and wage statistics. If you've ever been to PHI's website and looked at wages or employment, this is what we're drawing from, and it's collected by your state departments of labor, but analyzed by the federal government. And that's just one offering from the Bureau of Labor Statistics and your state departments of labor. These data are collected on an ongoing basis with consistent methodology, and that enables comparisons across time and states, occupations and industries, depending on which program you're looking at. And these can be really useful for tracking long-term trends in employment and wages. There are some roadblocks associated with these data, though. They're highly aggregated, so you may not be able to drill down to a specific segment of the workforce as home care workers who are providing waiver services specifically. Also, that consistency and comparability requires standardization, and that means these programs aren't as flexible or customizable according to your needs. And then finally, because of the research methods used in these programs, they're often based on employer surveys, and directing consumers are often excluded. But that does vary somewhat from state to state. Now turning to program data, there are lots of different sources of data you could look at here, like FMS providers who are supporting self-directing consumers, electronic visit verification or EVV vendors, state worker registries if those exist, things like background check registries or even training registries. And then also Department of Labor unemployment insurance wage records. These are sort of those administrative records that underlie many of the programs I've just described. The value of these kind of data is that they're more inclusive of the direct care workforce. You may be able to access data on self-directed workers, for example. And in some of your states, that's going to be really key given the size and growth in that space. They provide detailed information, potentially including roles, services, hours, wages, and tenure. And of course, given that these are programmatic data, there's strong alignment between programs and policies. But these also come with roadblocks. Data are fragmented across agencies and vendors and systems. And access can often require data sharing agreements and sustained partnership and collaboration. And linking data sets across this fragmented landscape can be technically and legally complex. These are all concerns that are absolutely navigable and may be worth it depending on your data needs. Finally, workers and providers themselves are sources of data. These could be things like provider surveys and reports or worker surveys and interviews. Of course, these are highly customizable to policy and research questions and can capture things like experiences, working conditions, and perspectives that aren't available in administrative data. Sometimes these can be useful for deepening your understanding of other data. So, for example, you may be tracking employment trends or workforce stability at the highest level. Workers and providers can provide insight on what's driving the trends that you're seeing. Of course, these come with challenges too. They're resource intensive to design and field tools and surveys and analyze the responses. And dissemination challenges can cause low response rates or biased or non-representative samples, things to keep in mind as you're pursuing this option. And then finally, because responses and respondents may vary from one time period to the next, they typically represent a snapshot in time than a continuous trend or continuous monitoring. So these are just some high-level thoughts on these 4 steps to get started with identifying your workforce needs and data needs. I'm going to turn the floor over now to our esteemed panel of experts from the state of New Mexico. New Mexico participated in the Direct Care Workforce Strategy Center as a recipient of technical assistance. And as part of that work, state leaders worked together to better coordinate direct care workforce data across agencies, starting by taking inventory of which segments of the workforce each agency oversees, what data already exists, and where gaps remain. I'm so delighted to be joined today by 3 key members of the team who led this effort. Let me just stop sharing my screen so that we can all see each other. Um, First, please join me in welcoming Deputy Cabinet Secretary Antoinette Vigil of the New Mexico Aging and Long-Term Services Department. Her agency supports older adults, people with disabilities, and their caregivers to live independently, safely, and with dignity. Jennifer Zwally, the Director of the Developmental Disabilities Supports Division within the New Mexico Healthcare Authority. DDSD administers person-centered programs and Medicaid waivers that support individuals with IDD to live, work, and fully participate in their communities. And Raquel Gomez, the Special Projects Coordinator at the New Mexico Department of Workforce Solutions. DWS is the state's primary labor agency responsible for workforce development, job training, and labor market data, among other functions. These 3 experts we're joined by today, we're very lucky to hear from them, and I think just in describing their respective agencies demonstrates the strong collaboration and interagency partnership that characterize this work. Antoinette, Jennifer, Raquel, welcome. I'd like to start with a foundational question about the data inventory project. What motivated your agencies to undertake a formal data inventory, and why was data a priority?
Thank you, Stephen, for the question. Really appreciate being here today and joined with flanked by my experts also at the fellow agencies. Really appreciate the work we've done so far. Had this not been an opportunity from the Strategy Center at the very onset, a little over a year and a half ago, I think, it posed the question that was really important for us to answer. And so spending this time getting to why did we decide to take this on and what important aspects of formally gathering data and why that became a priority is obviously the work that we've been doing. So I think amongst all of us, there is a growing crisis in New Mexico in particular, but also I'm sure across the nation that resulted in support from the administration and identifying the need to address this workforce, elevated as a priority across multiple state agencies on a number of fronts. As with other state departments, typically in government, working together sometimes does or does not happen. I'm fortunate enough to have a collaborative working relationship with my colleagues here, and they have staff that have participated in this as well. But typically government organizations work in isolation to a degree because you're busy working on your own mission-driven, responsibilities and initiatives. But together we needed to gain, I think we all decided that we needed to gain an understanding and a perspective amongst ourselves about this workforce, knowing that we were having an impact and a challenge. And as we all represent programs that utilize and depend on direct care workforces for service delivery, and participant success. So it was a mutual problem, challenge, question. And we realized that in many cases, we did not have data to inform us to tell the story. We were trying to identify what problem are we trying to solve? What is it that we want to present? What's the value proposition of that opportunity? And nor we didn't really know what each other was doing. So had it not been for the structure of the strategy development coming from the teams, we've had several with Strategy Center to help us pull us together, and then talk a little bit about what data we needed, what do we have already, who we needed data for, and how we were going to collect it, and then what we were going to do with it. So we heard what was most important to each work group, that each member of that work group, we learned about different priorities and the needs of each agency and program, and really came to understand the focus areas or the lens by which we were looking at things from our different positions and where we were perched on the tree, right? Also, how this could benefit each agencies and programs, but also any legislative or policy requirements that maybe were needed. And then who capacity wise and staff wise, did we have the capacity to participate in this initiative? We really collectively, I think, synthesized very early that our collective thought was to define what made up this workforce. And really our ultimate end goal was for us to access and utilize reliable data to inform and determine our strategy.
Thank you so much. I'm
Sure.
curious too, as you embarked on this effort, can you share kind of how you went about it, how you went about uncovering how each of your respective agencies were collecting data, and then similarly or relatedly, what challenges emerged as you were doing that process?
Hi, good afternoon, everyone. So in 2023, we actually had legislation passed for the agency that I work for, the Developmental Disabilities Supports Division, that required us to do exactly what we're talking about, collect demographic and wage data on our workforce, the direct support professionals serving people with intellectual and developmental disabilities. And so we use that as a starting point because it was new to us in 2023. We were not doing any of this type of data collection. And so we approached it by surveying our providers and really just seeing what we had. So with our work group in New Mexico, we used that, as I said, as a place to start. And so we really looked at the template that was in use and worked with the Strategy Center to develop a larger template where we were all able to collect data based on our direct care workforce amongst each of our different programs that we operate. So we really looked at a variety of data points that included just generally a brief description of each of our agencies and the populations that we served, what were our available programs and resources that each agency was providing, there was a section that we were able to list any of our activities or initiatives related to the direct care workforce, how each agency was currently, or maybe not, supporting the direct care workforce, and then how often and at what frequency and what data was being collected, if any, who reported the data, who the data was then reported to, what were the requirements, and then the different timeframes in which the data was to be reported. So we all took part in completing the template, and then we met and reviewed it all together. So it was a really great opportunity for us to break down our silos, learn what the other was doing, and how we were all really struggling with the same data elements and issues and challenges with the direct care workforce. And so with that information, a finalized report was put together. So we had a really nice one-stop shop for comprehensive data, which we were then able to use as we continued to advance our work related to the overall project. And then I'm going to pass it over to my colleague Raquel to talk about some of the challenges that we encountered.
Thanks, Jen. Good afternoon, everybody. So as Jennifer mentioned, after we collected all of the data, or each respective agency and program collected the data, each agency presented on not only the data, but also the agency and the programs and services that they offer, so that we could learn more about each other's programs and agencies and figure out where that overlap is. And that's where we found that there were gaps, right? I know that I'm not a subject matter expert on a lot of the programs, especially Jennifer's programs, but we knew workforce, right? We know labor market information. So coming together and learning more was really helpful. It opened it up for discussion and to ask questions. So we knew that initially we were working in silos from each other, especially when it came to the direct care workforce. And that was just the start of eliminating those silos and creating collaborative partnerships with each other. We knew immediately that there was going to be gaps in wage data because the department, we know that, when it comes to direct care workers, we only know what is reported, and there is a big issue with misclassification, or workers are, misclassified as independent contractors rather than employees. So communicating that to the work group and establishing that as an existing issue was something that we had to just kind of understand and know that that's something that we're constantly working through as the Department of Workforce Solutions that also manages our unemployment program. We also had, of course, many bureaucratic hurdles because we started this initiative over 2 years ago and had a shift in federal administration, which, of course, changed some of the priorities and some of the leadership that we had, of course. And we knew that, we would have competing priorities of policies and initiatives that were competing with the work that we were doing. So continuing to meet regularly to really have that goal of, creating this strategy and presenting it to our leadership and, implementing the strategy after it's been, developed and approved was really the end goal. So we've really, been able to overcome a lot of those bureaucratic hurdles just through our collaborative partnership and the network that we've established with each other. Of course, there were technical limitations, right? I want to make sure that I highlight that because as Jen mentioned, her agency didn't have the systems in place to be able to track the data that they needed to. We were already thinking of, creating data sharing agreements so that we would have access to each other's data, something that we don't currently have. And we know that we had planned for a tool, but we were relying heavily on legislative appropriation, and again, those escalated priorities with the funding and appetite to make this happen. So we had many challenges, but we continue to work through them, and we'll continue to work through them as we continue with the work.
Thank you so much. I'd encourage folks in the audience, please drop your questions in the chat. I'd really like to open this up for Q&A as well, but as one final question, I'm curious from the three of you, what did you learn through this process, and what lessons would you share with other states?
I'll go ahead and start. So I know we at the Department of Workforce Solutions learned a whole lot about the direct care workforce, and I think both Jen and Antoinette alluded to really come together to define what the direct care workforce is. Who are they? From our point, we can identify those occupations in the industry, and we're able to kind of isolate those occupations and get some of that high level labor market information as needed for the team. So I think really coming together to define what that workforce consists of is really important if you're starting this work. And continuing to work, at least from the labor perspective, on misclassification and trying to resolve some of those issues for the direct care workforce. We know that each agency does things differently. We have different data systems, there's different training requirements, programs, and services. But by working together and communicating that information and ensuring that each partner knows the services that we're offering, if there's any recruitment efforts or any outstanding current initiatives that we can partner on, it really helps close those gaps. And while the data sources vary, because we're able to provide labor information, and the HCA is able to provide program data, figuring out a way on how to make the different levels of data through those different sources work together was really important. And I'll hand it back over to Jen.
Thanks, Raquel. I just wanted to add a few things. So another thing that we learned is that people are very interested in this data, and we don't have the appropriate data systems to be able to capture everything that people are asking for, or that we as state agencies really need to be able to make better informed decisions. We at DDSD are doggy paddling. I put that in the chat. That's kind of where we're at right now. So we have a little bit, but certainly not enough. But the other thing, a few other things that we learned was that, as you mentioned earlier, Stephen, we too have a very fragmented landscape. We all do things a little bit differently. We all, like state agencies where I work, for example, we don't directly hire the direct support professionals or the direct care workforce. So we rely on providers who then, they are the ones determining the rate of pay, the incentives, benefits, etc. And because of that, we also don't set the payment base rate for people for the DCWs. So it is complex and very fragmented. And so one additional really important piece that really was a large topic of our conversations was the concept of the benefits cliff. And what we learned is that is a real and very valid concern, and sometimes a barrier to really supporting our direct care workforce, because so many people rely on benefit programs themselves, and we aren't able to offer them the career path with the appropriate base rate of pay, benefits, incentives, etc., that allow them to continue to work full time, support their families, and receive the proper benefits they need to be successful and live a quality life themselves. So I think that, all of that put together, again, really demonstrates the complexity of this issue and why we really needed to come together and work collaboratively, as Raquel, and all of us really are saying is what it's going to take. And also, as Raquel said, we're not finished. This work still continues. We're 2 years into it. We know a lot more than what we did when we started, but and we're definitely talking to the right people. But now we need to continue to move this forward in a very large way, not by each individual agency, but rather a larger statewide collective initiative, which has been challenging to do given the different changes at the federal level.
Yeah. Some themes that I'm hearing are just that importance of kind of retreating into your respective agencies, but examining your data in a uniform way opens up those opportunities for collaboration and learning. And also, this idea that improving and strengthening data collection is a journey and not a destination, I think will resonate with everyone in the audience. I do want to open up the floor for Q&A for a little bit here before we break up into small group discussions. Please use the hand raise function if you'd like to come off mute or drop a question in the chat.
This is Tina White in West Virginia. If I could ask a quick question.
Please do.
One challenge that we came across as we were trying to gather some statistical data is when we researched the labor market information, we realized that the direct care worker doesn't specifically have an SOC or standard occupational classification code. So it was a little confusing to us because we're not sure where employers actually classified or documented direct care workers that might be working for them. And I was just wondering if you came across the same situation.
Yeah, actually,
Yes.
we did. It was a big challenge, and we luckily have here in our department a great team of economists that work with our labor market information, and they pulled a sample of some standard occupational codes that fall within, the given industry. And our group together kind of examined all of those different occupations and determined, okay, yes, that falls within the direct care workforce, or no, that doesn't, right? So there were different occupations such as like, would we consider a primary care physician the direct care workforce, or, are we just focusing on physical therapy aides, on occupational therapists, on, all of these different occupations, which may or may not, but it really took the team coming together to kind of agree unilaterally on, does this qualify or does it not? And after we did that, we were able to kind of focus more within that scope that we, agreed on. But yes, it was definitely a challenge to determine, internally, what does that mean for us?
Okay, thank you.
Stephen, can I add something to Raquel's comment?
Yes.
Ma'am who asked the question, one thing we also discovered from that process and exercise for New Mexico, and this may be true for some other states, is the self-reporting structure. And so that in and of itself is probably where it starts and ends, and to some degree is problematic because they're not operating their business per se or functioning in this role or providing the service with their NAICS code in mind, for example. And so knowing where to define themselves in the reporting structure is also something that we realized we need to get a handle on. This has been something New Mexico's been doing for a very, very long time. I'm not quite sure that we have the leverage or the ability to maybe change the practice, but we recognize that it was an opportunity to at least start talking about how that can be changed or if it needs to be changed. Because good data in is only right, we're only going to get good data out as a good in. And so we have to take a look at the practice of this data. And that was something that we recognize is definitely still a fix that we'd like to address.
Thank you. Yeah, great thoughts there. I think we're running a little bit behind schedule, and that's okay. We could listen to the three of you talk about this experience and how this is going in New Mexico, I think, all day. What I would recommend, we're going to transition now into small group discussions. We've prepared questions for you to consider and talk through with your colleagues in those small group discussions. But if additional questions arise as you break out, you're welcome to report those back to the group as well, so we can have that as part of our discussion too. So as I said, we're going to break out into a few groups here. Jess is going to paste the questions into the chat that we'd like you to work through, but they're generally aligned with what we talked about today: identifying engaging partners, defining the workforce, specifying data needs, and then exploring data sources. I'd like you to aim to spend as a group about 5 minutes on each question. So we'll reconvene at 4:10. For each of your groups, please assign a scribe, someone who can record key takeaways. You don't have to be a stenographer, but just the big ideas to report out to the larger group when we come back together. So that scribe will both be taking those notes and reporting out to the larger group. Each of your groups will have one of us from the Strategy Center to help facilitate and move the conversation along. But this can be very organic. We're just hoping that we can sort of connect across states and organizations to talk about these issues. I will say, I know some of you are not with state agencies, so please feel free to speak from your experience working with states. I think that information can be helpful as well. So Lugla is going to send us into our small groups, and I'll see you all back at 4:10.
Okay, everyone, the rooms have been opened. You should receive a little pop-up and go ahead and accept and be on your way.
Thanks to our facilitators and speakers who shared their expertise in this recording. Thank you for joining us for this workshop session. We hope the strategies and examples shared today offer practical support as you continue strengthening your state's direct care workforce. This recording, along with related resources and materials, will be available on the Direct Care Workforce Strategy Center microsite at www.acl.gov/DCW. We encourage you to explore the other sessions in this workshop series, as well as additional lab talks, webinars, and resources for further guidance and promising practices from the field. If you have questions, need assistance accessing materials, or would like to learn more about technical assistance opportunities with the Strategy Center, please reach out to directcareworkforce@ncoa.org. Thank you again for watching, and we look forward to having you join us for future workshops and other resources.